Hi, I'm Eric with the Emergency Center. I was just going to give a quick tour. We're always open. We're a full functioning emergency room. We never close. So if you need something at 3 o'clock in the morning on Christmas, we're here. There's a big difference between a freestanding emergency room and an urgent care. Urgent care has a lot less features and availability than an emergency center. We are just like a large hospital ER, although we don't have some of the hassle with a large hospital ER. Our wait times are a lot easier. We have things like a CT scanner. This is a 64 slice. This gives great quality images. It's important to know which places have the higher quality CT scans because you get a higher level of diagnostic ability. In addition to CAT scan, we have plain films, we've got ultrasound, we've got a full set of labs, so we can do all the labs that we need to. Now of note, if you go to an emergency room that's attached to a hospital, not a freestanding ER, but one that's attached to the hospital, and you do a complete blood count, that typically takes about an hour between drawing the blood and getting the results. Now this is basically the same machine that they have in the hospital, and when we put the sample in, it takes 3 minutes. So why does it take so much longer in the hospital? Well, there's a lot more friction. You got to label the tube, put it in the pneumatic system, send it to the lab, gets in the queue, they got to process it, they got to enter the results. So just because it's a large system, there's more friction. That's one of the benefits of a freestanding emergency room, is things just happen so much faster. Again, we can offer the same types of services that an emergency room can, that's attached to a hospital. It's just, again, a lot more convenient. And we're also typically located in neighborhoods close to your house. You know, we got full crash cart, we got a defibrillator. So again, all the critical needs for life-threatening illnesses. We also have a complete and stocked lab. There are some freestanding emergency rooms that don't have quite as much for medications that we do. And another difference that we have, both compared to in-hospital ERs as well as freestandings, is we have these med packs. These are 72 hours worth of medications with instructions that we can provide to you, so at the time of discharge you get your medications. That saves you a trip going to the pharmacy. So everything that we're doing here is kind of focused on sort of patient convenience and speed of treatment. But again, it's important to know that this is an emergency room, not a clinic, not an urgent care. Urgent care, like I said, can be considerably cheaper, as well as a physician office, because they don't have the overhead of being open 24/7 with a CAT scan, ultrasound, x-ray, highly trained staff, and ability to handle life-threatening conditions. But if you need us, we're here. Thanks.